This is Amol Takalkar, the president of IASNM, and today we have a very special guest with us. We are starting this new initiative where we're going to interview on a very informal basis eminent giants in the field of nuclear medicine. And to inaugurate this session, we have nobody else but the great Dr. Alavi, who's a giant in our field. It was my honor and privilege about 17 years ago to train with Dr. Alavi at University of Pennsylvania in Philadelphia. We had one of the biggest programs at that time, and I have fantastic and very fond memories of those. Dr. Alavi is a person who requires no introduction in the field of nuclear medicine and imaging. He is a giant in our field. He even has a Wikipedia page in his name. That is just fantastic. He has numerous publications. He has written tons of book chapters. He has done the first FDG scan back in 1976, a very long time back. And most importantly, more than his papers and publications and contributions to science, his legacy is all the people that he has trained over so many decades. Each one of them is fond of him because he has made a lasting impression on many of us, including myself. We're going to interview Dr. Alavi today. With me is Dr. Ishani Dalal she's a senior physician at Henry Ford, Detroit, and she's also associated with Wayne State University as a clinical associate professor of radiology there. She's very involved in the society, and she is going to lead this initiative for IASNM. She's an executive member of IASNM. Hi, Ishani, how are you?
Hi, I'm fine. Thank you, Amol, for a very kind introduction. Dr. Alavi, we are very happy to have you here as our first person. And I'm really glad that you joined us. You accepted our invitation.
It's my pleasure and honor.
Thank
I would
you.
never say no to any of my students, particularly if they are great land of India.
Thank you, Dr. Alavi. And also with us is Dr. Deepak Behera. He is an MD, but he does not practice with us, so we call him, he's crossed to the other side. He's a consultant and works in the Bay Area, helping industry with their clinical trials, and he is very busy. I need to take an appointment just to talk with him these days. So, Dr. Behera, hi, and thank you for organizing this. You're our tech support guy. He's the one who's recording all this and is going to provide us all the necessary support. Thank you, Deepak.
Thank you, Dr. Takalkar. And that was too much of an introduction, I believe, but I'm really happy to be here and especially in the presence of Dr. Alavi. And thank you, Dr. Alavi, for agreeing to support this organization and being our first speaker. We are really honored to have you.
Thank you.
All right, so let's start our informal Q&A session. As they call this kind of a thing in India, it's chai with somebody. So today it's chai with Dr. Alavi. So our first question for Dr. Alavi is, briefly, can you tell us about your journey so far? Your start in this field, what inspired you, and what enabled you to reach your current position, which is very high. So. Please.
Well, I have to tell you a little bit about my life story. And I lost my father when I was 4 years of age.
Sorry.
And my mother, who I consider actually the greatest mentor of my life, ever since I remember, said, "We lost your father, but we're going to show to the world that we're going to survive and prosper." And also she emphasized that my father cried for 6 months and nobody could help him because he had gangrene of his legs and we didn't have a surgeon in our city. So she wanted me to become a doctor, to really make people not to suffer. So I, of course, went to school and I excelled in school, in elementary school, in high school, and I was particularly interested in sciences. But I want to also go to medicine, and I talked to my teachers. I asked them whether they use sciences in medicine, and they all said, of course they do. You have to take an exam in mathematics, physics, chemistry, and these are all used in medicine. So, of course, we had a very competitive entrance to medical school. Only 2%, 3% could go to medical school. But I had it no problem. I was actually first in mathematics in the entire country. So,
Wow.
yeah, just I was first in mathematics. There was a national exam and I took it and I was first. But in spite of that, I said I'll go to medicine because of honoring my great mother, who really was fantastic, did not get married, and just raised us with 50 cents a day. And, but we were the happiest kids in the school and did extremely well. All three of us, my sister, my brother, and myself. So I go to medical school and just start just looking at the subjects and our teachers. There is no evidence of science. Everything is descriptive. And I said to myself, Abass, what did you do to yourself? And I should leave and go to something else in some school that has technology. And I said, well, maybe just I should wait a little bit more. In contrast to what's going on between Iran and America these days, those days we had a very, very strong relation with America. And a lot of people were just, either in medicine or other specialties were going to America for further education. So I said, well, let me bite the bullet, remember all this nonsense that I don't believe in, and pass the exams and go to America to see if there's evidence for science. So I came to Philadelphia Einstein, Albert Einstein Medical Center as an intern, because we couldn't get into really anything higher than that. And all the foreigners those days used to go to community hospitals. There was shortage of physicians, much more than it is today. So, but we had to just apply to these community hospitals, and I go to Einstein, and first thing that I saw in the Department of Radiology was Mendeleev's chart, and I say to myself, this is science. This is exactly what I came to medicine to do.
Good.
But I just, didn't want to, of course, right away jump into nuclear medicine. This is 1966. And nuclear medicine was nothing, almost. Just very limited specialty. There was no boards. So I, of course, said to myself, I should just learn about American medicine, which I did. And I did internal medicine and took a year of hematology. And I said, but that was actually, again, by chance, because I couldn't go into any academic institution. I was at the VA, and as part of our rotations to another hospital, and there was a hematologist who used to just see me in the University of Pennsylvania conferences. And I used to ask best questions from the teachers. And he said one day, Abass, do you want to come to Penn? You are as good or better than any of our residents. I said, amen. And his name was Jim Bound. So that really was the opening for me to get into an academic institution. So I came to Penn, but still I had that mission in my head that I got to go to a specialty that truly will bring me to physics, mathematics, chemistry. So I took a year of radiology in Boston at Harvard. And then that was 69 to 70. And in 70, I came to Penn. And of course, that really completely changed my direction. This is exactly what I wanted to do in medicine. But really, I had to go through some complicated just pattern of and roads that just brought me to where I wanted to be in 1971. And the rest really is history, because when you like something, of course, I like to work. I mean, I'm all knows very well at working, even when I was in elementary school. I just, when the last exam was finished, I always, of course, was first in the class. I would be happy for 24 hours, and I will go to my mother and say, Mama, find me something to do. I'm going crazy. I got to do something. So I did a lot of little primitive jobs during the summer, selling ice and, just in the doing things that really were just not made for me, but I did it because I wanted to work. So really, this has made me to really go back to where I want to be in life and do something that I love to do, and then do it 7 days a week. I mean, as Amal knows, I mean, I just work 7 days a week, and
Yeah.
I just feel like I'm on vacation all the time.
Perfect, perfect. Yeah, kind of. I can identify with the culture. Even in our, like in my case, I'm a physician because my mother wanted to be a doctor. So kind of similar stories. So I can identify. We have a different culture where our parents have a lot of influence on how to shape our future. So I guess you kind of answered the next question in a which was kind of a similar one, like who's your role model or mentor and who had the most influence on you in this journey. I guess it's your mother, but is there anybody else who's influenced you professionally, or because you're a great mentor to us? So who was a great mentor to you in your young stage in your professional life?
Yeah, I joined, of course, nuclear medicine at Penn, where David Kuhl, KUHL,
Mm-hmm.
was the director of the program. You may know it, but David really was a genius, and he truly is the father of modern imaging.
Mm.
He introduced tomography to medicine. He was actually very much like me. He was very science oriented, mathematics oriented, and he just came to medicine exactly with the same intentions that people like me have had, namely, bring science to medicine. So David was extraordinarily nice to me. In contrast to some Americans, knowingly, unknowingly, being somewhat harsh on foreigners, and especially a country like Iran, you cannot be good if you have been brought up in Iran. So David was never like that. David just treated me as a precious person in his department, and just right from the beginning, he treated me different from American students he had, and in fact, he kept me on after 2 years of fellowship that I have. That was an NIH-funded fellowship, and I was planning to go to get a PhD
Mm-hmm.
because I thought that will further enhance my ability to do research. And I said, they would say, Abass, what are you going to do? I said, I'm planning to go to Hopkins to get a PhD. In fact, I had arranged with Henry Wagner, another giant of the time,
Mm-hmm.
to go there. And he said, Abass, you don't have to go to get a PhD. David never had a PhD. He just
Oh, okay.
majored in physics and just but came to Penn after he had his college at Tempo, and just as an MD, he did everything scientific, and he said, Abbas, I did not get a PhD, and look what I've done. So I'm not going to let you go to Hopkins. I'm going to keep you on. So he truly played a major role. After my mother, really inspiration and encouragement, David was a fantastic person, and I really became his, most famous trainee, and he was always very proud of me, and I'm really, just so grateful that he took me under his wings, and of course he left Penn in '76, which led to me becoming the chief. I mean, they were looking around, and then one day the head of the department came and said, well, we have decided to make you the chief of nuclear medicine. We haven't seen anybody better. I said, this is hard to believe that
Yeah.
I'm on David's, putting my feet in David's footsteps. And so it really, it's just one good thing after another. And, just getting involved with Pat. And right from the day zero in '73, we discussed, David and I, labeling deoxyglucose with fluorine 18. Yeah, that's it. They have
73, huh? That's a long time back.
yeah, and then in '76, we shipped the first FTG from Brookhaven National Lab to Philadelphia, and I did the first human studies.
Yeah, so Dr. Kuhl must have been a great mentor because you it rubbed off well on you because you've been kind and a fantastic mentor to a whole lot of people. So that's a great act, and I guess having a great mentor helps a lot. I try to certainly help others as much as I can, trying to get something from you and pass it along. So I try to pay to the future, invest in the young generation and help them as much as I can. So that I certainly got from you. So I can really appreciate having a great mentor. You and Dr. Lillian, who hired me first time after I graduated from FEM, have been fantastic mentors for me. So I really appreciate you telling us about Dr. Kuhl. I'm sure people would appreciate knowing that. So moving on to our next question. How has nuclear medicine impacted you as a person?
Well, I did really it has shown me that if you have a functioning mind and determination and looking really just to the right path, you are going to really succeed in life. I mean, this is really, I knew exactly what nuclear medicine is going to look like even 50 years ago. I've just said to myself, that this is really very as clear as light, as daylight. You have a molecule, you label it, and give it to a human being and see it so transparently by detectors. Of course, we didn't have sophistications that we have today, but even with those days technology, it was very clear to me that this is the future of imaging. And I will even go further. This is the future of medicine. There's no question in my mind that there is no other more powerful methodology and technology than molecular imaging with PET. I mean, this is just the future of medicine in every level you can imagine, from making drugs and seeing where they go to diagnosing diseases and coming up with the label compound to treat the patients with serious diseases such as cancer. So really, I had the same vision that I have today 50 years ago, that this is really the right path. It's so logical. It makes so much sense. And I really had difficulty seeing radiologists and other people who really were so limited in the scope of imaging to discourage people like me and others who really were seeing the true potential of this modality. So really, I just knew right from the outset that this is really going to blossom into many, many directions. And fortunately, it looks like my vision 50 years ago has really materialized. I mean, this is why I'm not retiring.
You should never retire, Dr. Alavi.
Just last year alone, I published 65 papers. I can't believe it. But
That's just amazing. And
like,
it's amazing that 50 years ago you saw it's almost prophetic that your prophecy is coming true with molecular imaging and theranostics, and what is becoming clear now, you could see it quite clearly 50 years ago, and you were on that same track and persevered. So that's awesome. So moving on to our next question, you have obviously trained a lot of people over the past several decades. Tell us if there is one particular trainee who has touched your heart and made a lasting impression on you in any way.
well, I love all my students. They are my children. And I've got hundreds of them all over the world. And some of the most successful people in many countries in the field are my students. So really, I don't want to really just say one person specifically as being my favorite student. I think all of them are my favorite students. But I'm very fond of Indians, and I'm so happy that two of my students have gotten the award from the president of the country, that has got 1.23 billion people, having two of my students rise up and get the highest award from the.
That's just amazing.
That is truly amazing. It just
Yes.
made me so happy. And, I just, there are two of my most favorite students, and I want to just say it very clearly, even though I have trained a lot of geniuses, a lot of students of mine have become leaders in their country, Francois Bernard in Canada, Carlos Washbugu in Brazil, and many in Europe. But those two stand out. And I think that made me so proud because
Awesome.
that city, they are in the category of the highest scientists in the country.
That's awesome.
Every year, they choose no more than 10 people. And these two guys were among them because they were most cited and most published and in the country. And it just, this is without any equivocation, they are just the highlight of my, training program.
Perfect. Yeah, and I know one of them very well. So I know Rakesh Kumar pretty well. So I agree that one of the best. So moving on to our next question. Is something that you're very passionate about. You're definitely very passionate about FDG. Many consider it the molecule of the 21st century. So can you tell us why you're so passionate about FDG?
Well, I think glucose, luckily, is the predominant molecule in our body. And almost every organ is using glucose. Like I'm looking at bone glucose metabolism right now. This is one of my research projects. So it's not only the brain, it's not only cancer, it's not only inflammation, it's just almost every process in the body, it just is based on glucose. And having this very nice arrangement that glucose 6-phosphate doesn't go beyond glucose 6-phosphate was God's gift to us. So it was just an incredible, just coincidence of our thinking and the possibilities that somehow we made it possible. And it was a very lucky thing. Our friendship with people at Brookhaven National Laboratory and our ideas, it led to having this compound. But even beyond that, if you have cell perforation, you're going to use a lot of glucose. So why do I have to have FLT that doesn't tell me more than what I can get with FDG? This is really what really has made FDG the centerpiece of future of molecular imaging. If you have hypoxia, you use a lot of glucose. And you don't have oxygen, you have to use more glucose to get the same amount of energy. So the reason that I'm really still very passionate about FDG is that we have only touched two major areas of FDG, brain imaging and oncology. Yet there are 8 major applications for FDG. I can detect clots. All the patients who are looking for, have had pulmonary embolism, or suspect thrombosis, should be looked at by FDG. I want to look at every inflammation with FDG. I want to look at all the infections with FDG. So atherosclerosis, we can detect with FDG. So we have only gotten approval for 2 applications of FDG, brain and oncology. Why shouldn't we push FDG and play around with so many other things that will take another 20 years to get approval from the FDA? FDG was not approved as a tracer by the FDA and of course later on by Medicare until 1978, 79. So I'm 1997, 99, 98. So really, it took a long time to get approval for just using FDG for oncology. So I'm going to put all our efforts into making all these 8 applications of FDG approved before pushing so many other tracers. And honestly, You see, these have become tools for people to get grants, to get promoted. So look at all the publications on, more than, well, there are hundreds of compounds that have been used as a research tracers, but none of them has made it all the way. There's resistance, first of all, on the part of both the community as well as Medicare. Medicare doesn't want to add more, tests to pay for them. So why not take advantage of all 8 applications of FDG before try to push other tracers, because just they're not, doesn't make sense. Because I mean, in my view, blood flow belongs to 20th century, not 21st century. Blood flow changes after you have changes in metabolism. So using flow tracers of any kind, like looking at perfusion in the heart, I just don't think that we have to do that. We should either look at calcification with sodium fluoride to see coronary arteries in the heart, rather than using perfusion agents that are so cumbersome and doesn't really give as much information. They're not that sensitive either. So however you look at it, metabolism is the centerpiece, and #1 metabolic tracer in the world is FDG. So let us try to do what we can do with FDG before moving on to so many other pathways. I'm not against it, as I said. As a scientist, I want to do all these research studies, but do it once to understand some disease process, but don't make them look like that is you aim to bring them to clinical practice. Let's just do what we can with FDG and then look forward for other tracers to become a reality.
Awesome. That was a very good answer. I think Medicare certainly has fiscal constraints, so we are in a financial crunch when all these new tracers, which are very expensive, are going to come out if and when they get approved. But moving on to a new question, it's slightly different. So if you have to retake this journey, what would you do differently?
I'm sorry, what is it?
If you have to retake this journey you have taken so far, if you have to redo, if you get a second chance back 60 years, 70 years in time, what would you do differently now?
Honestly, I probably wouldn't do anything differently. I mean, as I said, my life experience had some bumps in it, and I really, just looking at it in retrospectively, I'm glad that I went through difficulties that I had in my life. It was just challenging, but it is everything that was challenging taught me something. So I just wouldn't do anything differently than what I've done. And you have to have determination in life. You have to have an aim in life. Just charge ahead. Don't look right. Don't look left. Just charge ahead. This is really what I have done. And really, just in everything you do in life, if you enjoy it, you're going to succeed. I mean, I love succeeding, as everybody does. But in particular, I just make up my mind and aim it in the right directions. As a foreigner, as I say, and being from the Middle East, there was discrimination against me. But I just showed them the way that I want to eventually them to learn that really they are not going to be able to stop me, put all the obstacles on my path and just overcome them and come in one piece and just show them that this is really something that they couldn't have done it to harm me. So I just wouldn't do anything differently. I like challenges in life, and I like to just overcome them. And because I think otherwise, you're sitting on the beach and watching the waves are not going to take you anywhere. You got to look for challenges in life and overcome them as best as you can.
I kind of suspected that answer because I knew that you have no regrets and you're very very happy with the way you have achieved everything in life. So now we're going to switch gears a little bit and ask you something more personal. Like, do you have any hobbies, or do you feel passionate about something else other than nuclear medicine?
Well, my being brought up in a relatively primitive society, I became very much fond of nature. My mother used to take us to the outskirts of my hometown, Tabriz, in northwest of Iran, and I really enjoy nature. I mean, that city become my really a major thing. And whenever I have time, just my wife and I just will walk in the woods and just seeing nature, streams. I really like the waterfalls, and it just those are that's the from the aspects of just a hobby. That's probably the most important hobby I have. But the other hobby that I have is the politics. Seeing what has happened in my part of the world and seeing what we witnessed in the past 4 years in this country, really has made me very curious. So I really like to read a lot about really what's going on in politics. I'm very interested in the history, having again grown up in a country that has got thousands of years of history. Have made me very excited about what went on in the world and what we have learned. You asked me about what we have learned, in my life, what we have learned as countries and cultures. So that really is another my major hobby that I read about, and in the newspapers, New York Times, are very major part of my weekends to look at to see really how they're interpreting all the events that took place during the past 4 years with Trump. And so these are the two major hobbies. I can call them hobbies. And of course, I like music. I grew up with the Turkish music, which is a very exciting music. I listen to music in my office. I listen to music in my car, Turkish music. So that's another source of pleasure that is outside my work.
Nice, nice. I didn't know about Turkish music. You had a liking for that, so that's news. So that's good. Moving on to our next question. I mean, certainly these are unprecedented times for medicine in general and nuclear medicine in particular, with all the specific probes and theranostics. But as you alluded to, you've been through this journey for a long time. So are there any lessons from the past that you would like to share with the audience in this regard?
Well, I think this is a very, very unfortunate episode, especially for our field, as you just mentioned. New therapies are very, very exciting, but having interaction with patients while we are treating patients is a major challenge. I mean, this is really what's happening in every specialty, but other specialties can tolerate it better than we can. We are a very small specialty. We really are facing significant problems in bringing these new therapies to day-to-day practice. So really, it's very, very unfortunate. But again, life is never predictable, and good minds can just at least get around these obstacles and do 80% of what we could do under good circumstances. So, what we're doing is the best we can, and it's not really only nuclear medicine that is suffering. The research in every field has just come to standstill. And I still go to work, and I'm a researcher, and 80%, 90% of the people are not coming to work. I mean, I love going to work, and my work is not dependent on just dealing with patients or doing some experiments. So I'm able to do it, but this is really completely has stopped. All the people who are doing instrumentation in physics, we have a very strong instrumentation group. We have a very strong chemistry group. They have completely stopped. They just couldn't really have everybody be only 2 feet to each other and do chemistry work. So it really is not only the clinical practice that has suffered. I think many aspects of our field, as well as, of course, other specialties. And I suffer with right now, because I'm at the Hospital of the University of Pennsylvania. We have only 80% of the beds are occupied, and of course we have now 4 or 5 intensive care units. So those obviously are taking away a lot of elective surgeries, elective other procedures. So really it's not only us. It just it's happening to everybody, and hopefully vaccine will do it. And that really is our and my best hope that will bring us back to where we were a year ago. It's just incredible how nature could really do this. There used to be cholera, there used to be smallpox, and those were, at least we were able eventually to put them aside. But never ever anybody thought that this little virus could really turn the world upside down and just make everything so difficult. Imagine all these mothers, who cannot send their children to schools, and they are professionals and they want to take care of their work, and they cannot. I mean, this is really becoming so devastating to so many disciplines and professionals, and I think we really are affected, but I think so is everybody else.
Mhm. So I guess your motto of facing the challenges come what may, and persevering is probably going to help us get through this as a person, as a family, as a field, as a team, and hopefully there'll be light at the end of the tunnel as vaccinations help in, and then effective treatments come in. So I agree that it has affected a lot, and it's just a challenging time for all of us. So that kind of brings us to our concluding part. And Ishani, do you want to have any parting thoughts, any last questions for Dr. Alavi before we conclude?
Yeah.
Go ahead.
Sure. I have a question for you.
Sure.
Dr. Alavi. Yeah. What is your parting message? What is your parting message to younger generation who are embarking on their journey or are in the, what I should say, mid-career in this field that we cherish?
Yeah, especially since the majority of Indians, at least they are first generation in this country. So they really are going through the same steps that I've gone through over the past 55 years that I've been in this country. I think my major message is to work as hard as you can. You definitely have inherited your brain function, just whatever your genes have given you. But what you're not going to be able to change that. But what you change is your work habits. This is what I tell all my students, and I'm sure that them all have heard me. Work as hard as you can. That is number one. And try to really conform yourself to the environment. Don't try to step on somebody else's toes, especially as foreigners. We really have lower walls than someone who's been born in this country, has all the connections and all the privileges. So just be careful. Just be very political. Don't just try to go beyond what you can handle. Yes, stand up when it's needed to defend your rights, but don't overdo it. This is really the other major message that I want to give to my Indian colleagues, that you got to just be a good politician. And I think these two are the two major lessons that I've learned. Know my limitations, but also just work as hard as I can, day and night. This is really what you have to do, especially as first generation. I think that this is really what you have to do to succeed. And I just, a lot of my American friends come to me and say, we don't think that you are a foreigner, because I've just conformed to the environment. I just deal with them as if I've grown up with them. So it's just something that you learn over time. And I just want to just emphasize, especially for younger people, especially people who are not as privileged to have gotten into great positions and and have been really intellectually very powerful. Those people are the top 5%, 10%. But the majority of the people really who are really above average, just hard work is going to make up for their limitations that they may have in the ability to move up and prosper. So these are the two really major messages that I want to convey to Indian community, because I'm very fond of Indians and I just want to see them succeed. And I'm so happy to see all these consultants and CNN in various specialties are Indian. This is fantastic. It just makes me so proud that to see just another ethnic group to this country go through the difficulties and shine and prosper and show them they're just as good, maybe even better than general Americans. So I think you've got a lot going for you.
Thank you. Thank you. We appreciate that. I'm sure we're going to see Deepak Behera as one of the consultants pretty soon on CNN in the next couple of years or so. Right, Deepak?
Yeah, and I think, you guys are showing to the Americans, Native Americans, that foreigners don't have horns.
So that's
I remember when I went to Einstein, when I was in it, and I was taking care of a patient, and she invited me to the home, and she had the teenager girl, and I had lunch with them and talked with them, and then she sent a note to me and says, Dr. Alavi, we thought that you lived in the tent in Iran. When we talked to you, you talked like the rest of us.
Yes.
It's just amazing that what the views of Americans are of other countries and other people is so different than the reality, and you just have to show them the facts.
Yeah. Very good, Dr. Alavi. So that was our last question, and that's a very good and useful parting advice to the young and even not so young professionals in our society. So we appreciate the time and all your advice, and we really appreciate you doing this for us. And I would like to thank Dr. Dalal and Dr. Behera for joining me and helping with this interview. We really hope that this makes a big impact. We wanted to start with a bang, and I'm sure we can't get anybody better than Dr. Alavi to start this initiative for IASNM. So from the bottom of my heart, thank you. We love you, we appreciate you, and we love you that you love India as your second adopted country. So with that, I'm going to sign off unless you have any last words to say.
Thanks for inviting me. I mean, this is a great honor. I'm just very grateful that you've chosen me as the first person for this interview. It's just another pleasure for me dealing with my Indian students and colleagues. Thank you so much. Good night.
Thank you.
Thank you.
Good night.
Bye.
Bye.
Good night. Thank you so much. Bye.